Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. The association between NSAIDs and heart failure in patients with diabetes. Short-term use of non-steroidal anti-inflammatory drugs or NSAIDs is associated with the first-time hospitalization for heart failure in patients with type 2 diabetes, according to research presented at ESC Congress 2022. The researchers used Danish registries to identify patients diagnosed with type 2 diabetes from 1998 to 2021. Patients with heart failure or a rheumatological condition requiring long-term NSAID use were excluded. Information was collected on prescriptions for oral NSAIDs claimed prior to first-time heart failure hospitalization. Using a case crossover design in which each patient acted as his or her own control, associations between short-term NSAID use and the risk of first-time heart failure hospitalization were assessed. The study included 331,189 patients with type 2 diabetes. The average age was 62 years and 44% of them were women. NSAID use was associated with an elevated risk of first-time heart failure hospitalization. When individual NSAIDs were analyzed separately, the risk of heart failure hospitalization was increased following the use of diclofenac or ibuprofen. The researchers also analyzed the risk of heart failure with NSAID use in subgroups of patients. Strong associations were found in patients above 65 years of age, while no association was found in those below 65 years of age. The strongest association was found in very infrequent or new users of NSAIDs. The link between air pollution and heart attacks in non-smokers. This study investigated the associations of nitric oxide, particulate matter with a diameter less than 10 micrometer or PM10, and weather with the incidence of myocardial infarction in Berlin. Nitric oxide originates from combustion at high temperatures, in particular from diesel vehicles. Combustion is also a source of PM10 along with abrasion from brakes and tires and dust. The study included 17,873 patients with a myocardial infarction between 2008 and 2014 enrolled in the B2HIR2. Daily number of acute myocardial infarctions were extracted from the same database along with baseline patient characteristics including sex, age, smoking status and diabetes. Daily PM10 and nitric oxide concentrations throughout the city were obtained from the Senate of Berlin. Information on sunshine duration, minimum and maximum temperature and precipitation were retrieved from the Berlin Tempelhof weather station and merged with the data on myocardial infarction incidence and air pollution. Regarding pollution, myocardial infarction was significantly more common on days with high nitric oxide concentrations, with a 1% higher incidence for every 10 microgram per cubic meter increase. Myocardial infarction was also more common when there was a high average PM10 concentration over the 3 preceding days, with a 4% higher incidence for every 10 microgram per cubic meter increase. The incidence of myocardial infarction in smokers was unaffected by nitric oxide and PM10 concentrations. Regarding weather, the incidence of myocardial infarction was significantly related to the maximum temperature, with a 6% lower incidence for every 10 degrees Celsius rise in temperature. No associations with sunshine duration or precipitation were detected. Glyphosate's effects on the nervous system. A recent report by the United States Centers for Disease Control and Prevention found more than 80% of urine samples from children and adults in the US contained the herbicide glyphosate. A study by Florida Atlantic University and Nova Southeastern University takes this research one step further and is the first to link the use of the herbicide Roundup, a widely used weed killer, to convulsions in animals. Results published in scientific reports showed that the glyphosate in Roundup increased seizure-like behavior in soil-dwelling roundworms and provides significant evidences that glyphosate targets GABA A receptors. These communication points are essential for locomotion and are heavily involved in regulating sleep and mood in humans. The study found that the active ingredient glyphosate exacerbated convulsions in C. elegans and suggested the GABA A receptor as a neurological target for the observed physiological changes. The data also indicates that there is an important distinction between exposure to glyphosate and Roundup, with Roundup exposure increasing the percentage of C. elegans that did not recover from seizure activity. The non-recovery phenotype and prolonged convulsions in C. elegans from this study have helped to set a foundation for understanding nuanced physiological effects of herbicide that occur at concentrations exponentially below neurotoxic levels. Findings also generate concern over how herbicide use might affect soil-dwelling organisms like C. elegans. The tomato flu. Tomato flu is a self-limiting illness and no specific drug exists to treat it. The tomato flu was first identified in the Kollam district of Kerala on May 6, 2022, and as of July 26, 2022, more than 82 children younger than 5 years with the infection have been reported by the local government hospitals. To date, apart from Kerala, Tamil Nadu and Odisha, no other regions in India have been affected by the virus. The primary symptoms observed in children with tomato flu are similar to those of chikungunya, which includes high fever, rashes, and intense pain in joints. Tomato flu gained its name on the basis of the eruption of red and painful blisters throughout the body that gradually enlarged to the size of a tomato. Because tomato flu is similar to chikungunya and dengue, as well as hand, foot, and mouth disease, treatment is also similar. That is, isolation, rest, plenty of fluids, and hot water sponge for the relief of irritation and rashes. Supportive therapy of paracetamol for fever and body ache and other symptomatic treatments are required. Similar to other types of influenza, tomato flu is very contagious, hence it's mandatory to follow careful isolation of confirmed or suspected cases and other precautionary steps to prevent the outbreak of the tomato flu virus from Kerala to other parts of India. Drug repurposing and vaccination are the most efficacious and cost-effective approaches to ensure the safety of public health from viral infections, especially in children, older people, immunocompromised people, and those with underlying health issues. As yet, no antiviral drugs or vaccines are available for the treatment or prevention of tomato flu. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.